sometimes it's the tiniest changes that tell the biggest stories. You're just a few weeks into your pregnancy, yet your body is working overtime, and while you might not have that baby bump yet, so much is happening inside. Transformations, symptoms, emotional roller coasters, and milestones you didn't expect. The second month is often when reality starts to sink in. That test was positive, the lines were clear, and now you're here. But what exactly is happening in your body? What should you expect, avoid, and prepare for? Stay with me as we go deep into everything you need to know about the second month of pregnancy. Hi everyone, I'm Dr. Alina Grace. As an OB/GYN and passionate women's health educator, I believe every pregnant woman deserves knowledge, confidence, and clarity. Pregnancy can feel overwhelming, especially during the early months, but it's also magical and empowering. Once you understand what's going on inside your body, today's video is your complete evidence-based guide to the second month of pregnancy. Whether this is your first time or your fourth, this video will cover every important aspect: your baby's development, your body's symptoms, critical do's and don'ts, nutrition, emotional health, and how to prepare for what's next. Let's walk through this month together. By the second month of pregnancy, you're roughly 5 to 8 weeks in. You may still be adjusting to the idea that you're pregnant, and often this is the time symptoms really start to appear. One of the earliest and most noticeable is nausea. Morning sickness. Despite the name, this can hit at any time of the day or night. Hormonal surges, especially human chorionic gonadotropin, HCG, are responsible. The placenta is forming and your body is flooded with hormones supporting early development. Your breasts may become more tender or swollen. Some women describe a tingling or fullness that is completely new. Fatigue becomes more intense. Why? Because your body is creating the placenta, the essential organ that will support your baby for the rest of the pregnancy. That's a lot of energy. It's normal to feel exhausted, even if you're just going about your normal routine. Rest is not laziness, it's necessary. Cramping and light spotting can occur. While any bleeding during pregnancy should be monitored, light spotting in early pregnancy is not uncommon and may relate to implantation or changes in the cervix. Always let your doctor know to be sure it's nothing serious. Now let's talk about what's happening with your baby. During the second month, your baby is still called an embryo. At the start of this month, it's just about the size of a blueberry. But don't let that fool you. Tremendous development is underway. The neural tube, which later becomes the brain and spinal cord, closes. The heart is beating. A tiny flutter visible by ultrasound. Arm and leg buds begin to form, as do facial features, ears, and eyes. Major organs like the liver, kidneys, and lungs are beginning their formation. This is why it's such a crucial time. Any exposure to harmful substances can affect organ development. Nutrition is vital. Make sure you're taking a prenatal vitamin rich in folic acid, iron, DHA, and calcium. Folic acid helps prevent neural tube defects, iron supports increased blood volume, DHA aids in brain development, and calcium strengthens those tiny forming bones. Eat a balanced diet with whole grains, lean proteins, fruits, vegetables, and healthy fats. Hydrate well. Water is essential for circulation, amniotic fluid, and digestion. Avoid high-mercury fish, unpasteurized products, undercooked meat, and of course, alcohol and tobacco. Limit caffeine to under 200 milligrams per day. This means one small coffee. And remember, caffeine hides in tea, soda, and chocolate too. Emotionally, the second month can be surprising. Hormones can make you feel anxious, emotional, or weepy. That's normal, but support is key. Talk to your partner or a close friend. Journaling can help you process. And don't hesitate to speak to a healthcare provider if feelings of sadness persist. This is also the time when your first prenatal checkup usually happens. This is an exciting step. Your doctor may confirm the pregnancy with a transvaginal ultrasound. You may hear or see the heartbeat. Blood tests will check hormone levels, blood type, immunity, and screen for infections. You'll likely discuss your medical history, diet, lifestyle, and any current medications. It's crucial to be honest and open. This appointment lays the groundwork for your care ahead. Midway through this video, I want to gently remind you, if you're finding this helpful, don't forget to like and subscribe to stay connected. I create these videos to support women like you every step of the way through pregnancy, and your engagement helps me reach more mothers. Let's continue. Exercise during the second month is encouraged, but within reason. Gentle walking, stretching, yoga, designed for early pregnancy, and light swimming are safe and supportive. Avoid anything that causes overheating, contact sports, or heavy lifting. If you're not sure, ask your doctor. Movement supports circulation, boosts mood, reduces constipation, and helps with sleep. Speaking of sleep, you may notice it becomes a bit erratic. Hormonal changes, emotional shifts, and increased urination can disrupt your night. Try to establish a calming bedtime routine. Avoid screens before bed, support your sleep with a pregnancy pillow if needed, and stay hydrated, but drink less close to bedtime to reduce nighttime bathroom visits. Another common second-month symptom is food aversions. Suddenly, foods you once loved may turn your stomach. This is also due to hormones. Try not to worry, eat what feels safe and appealing, and focus on small, frequent meals to prevent nausea and maintain nutrition. Bloating and gas are also common in this month. Progesterone slows digestion to support nutrient absorption for the baby, but it also causes discomfort. High-fiber foods, water, and walking can help manage this. At this stage, some women also start noticing changes in their skin. More oiliness, acne, or that pregnancy glow. These are all driven by hormonal changes. Keep your skincare routine gentle and avoid products with retinoids or salicylic acid unless approved by your provider. Don't forget oral health. Gum sensitivity and bleeding are common. Hormones affect your gums, so brush gently, floss daily, and consider a dental checkup early in pregnancy. You may also find your sense of smell becomes heightened. Even mild odors can become overpowering, triggering nausea or aversion. This will likely improve later in pregnancy, but in the meantime, keep your environment well ventilated and avoid strong scents. Now let's talk about what not to do. Don't self-medicate during pregnancy. Even common over-the-counter drugs can be unsafe. Always consult your healthcare provider before taking anything, even for a headache, cold, or allergies. Avoid hot tubs, saunas, or any environment where your body temperature can rise too high. Heat exposure in early pregnancy can be risky. This is also the time to plan. Research maternity care providers, whether you want a hospital birth, birthing center, or midwife-led care. Discuss your preferences, concerns, and values. It's also wise to start budgeting and planning your maternity leave if you're employed. Emotionally, give yourself space to breathe. The second month can bring fear of miscarriage, fear of unknown changes, and fear of responsibility. These feelings are human. Trust your body. Trust the process. You are stronger than you think, and this journey will reveal just how resilient you truly are. Let's quickly summarize what we covered. The second month of pregnancy spans weeks 5 to 8 and is a period of rapid development for your baby. Symptoms like nausea, fatigue, breast tenderness, and emotional shifts are common. Nutrition, hydration, and prenatal care are crucial. Gentle exercise, good sleep habits, and emotional support can all improve your experience. Avoid risky substances, hot environments, and unapproved medication. Start planning ahead while being gentle with yourself emotionally. If this video helped you understand your second month better, don't forget to like, share, and subscribe. Every pregnancy is unique, and I'll be here each month with more detailed, practical guidance. Let me know in the comments how your second month has been. I'd love to hear your experience. Thank you so much for spending time with me today. Stay safe, stay informed, and stay connected to your beautiful journey. I'm Dr. Alina Grace, and I'll see you in the next one.